So what are the alternatives? I mean, in very simple terms, we've always had alternatives. There's always been non-medical understandings running alongside medical ones, since psychiatry began about, 200 years ago, whenever you want to start that. And there are a number of alternatives, one of which is simply to use ordinary everyday language, isn't it? You feel desperate, you feel terrified, you hear voices, you have mood swings. A particular alternative that I've become very interested in myself is called Formulation, and that may or may not be a familiar term it's certainly familiar to some counsellors and psychotherapists, but in brief, a formulation is a kind of narrative or story or hypothesis, if you want to make it sound a bit more important, which is put together collaboratively with the client and the therapist. And the therapist brings to that process their clinical experience, their knowledge of the evidence, and so on and so on. And the client brings their life experience and the sense they've made of it and the intuitions that they've, developed for themselves. And if you put them together, you can get a kind of narrative, an evidence-based narrative, if you like, which might look like a diagram, might look like a few paragraphs, which is co-constructed, which evolves, which is not, the truth about somebody, but it's our best guess at the moment. We come back to it, we revisit it, we add bits to it, and so on and so on. So in a sense, there's various senses in which you can talk about formulation, one of which is a formulation as an event or thing that's written down, and it's a core skill for all clinical psychologists. So that's what clinical psychologists have to do in their training, have to produce lots of these. But I think actually in a way it's better understood as a process. It's a kind of outcome of a therapeutic conversation, and at some points it may be useful to actually write it down in some semi-structured form. And more generally, I would see formulation as a whole way of thinking about emotional distress, and within adult mental health services, which is where I've most often used formulation, it is, the assumption that at some level everyone's experiences make sense. There's no point at which you have to stop and say, oh, it's because they've got schizophrenia, or oh, it's because they've got a, personality disorder, or whatever. So it's both an event and a process and a way of thinking, in my view. And so in the general sense of making meaning of, of course, in a sense, we all formulate all the time, not just counsellors, not just therapists, but people.
Yes, humans, yes.
So, I mean, I don't think you have to write it down, if you like. Some people choose to work it their way and some people don't. I think there are particular advantages, particularly in adult mental health settings, because the word is quite widely used. Psychiatrists actually will have some training in formulation. It's about to appear as one of the core mental health skills for all mental health professionals in England, thanks to the hard work of a working party I've been involved in. So that would mean everybody, nurses, social workers, support workers, related professions as well, need to have some knowledge of what that's about. So you could see it as a bit of a sort of Trojan horse, which allows you to get in there with a different set of ideas, and which provides a more credible alternative. What do you do instead of diagnosis? Well, actually, we have this process. There's quite a lot written about it. My professional body, the Division of Clinical Psychology, has drawn up best practice guidelines. In fact, I led a small working party producing those, because it seemed to us that if we're going to have this practice, we need to do it sensitively, ethically, reflectively, collaboratively, all those kind of things. So that is one of a number of alternatives, but one that has some advantages in services, and from my point of view, it's one of the most powerful ways I've found of shifting mental health cultures, starting from where you are, if you like.